Good morning, good evening, good afternoon. This is Dr. Garais, MED104, Medical Terminology, and this is the video for Chapter 6. Sensory System, Ophthalmology, and Otorhinolaryngology. Add rhino to this, and you have ENT. Otto, that's your ears. Rhino, nose. Laryngo, that's your larynx or your voice box. Ophthal, meaning your eyes. Logi, well, ophthalmo, eyes. Logi, study of your, of course, eyes. And both of these people are MDs. They went to medical school. Let's look at some words and focus on how the textbook breaks these down, because they're actually helping me and you out at the same time. They're grouping things together. And remember, in education, that's called chunking, which is pretty smart. So oculo, ophthalmo, and opto all means eyes. So you have a lot of suffixes that that you already learned. So oculopathy, pathy, suffix, y, process of disease of your eyes. Ophthalmologist, that's the person, that's the MD who deals with your eyes. The optometrist, that is the professional. Opto, eyes. Meter, to measure. That's the person who does your diagnostics and measures all the proper measurements for your eye, for your eyeglasses and eyewear, and also your uh, contact lenses. And the optician, which isn't here, the optician is the person who actually makes them, the glassware and your contacts. So you have ophthalmologist, optometrist, and optician. And remember, the ophthalmologist is the MD, and the optometrist measures, meter, and the optician is the one who actually makes the glassware. Lacrimal or dacro means tears, so lacrimation, process of making tears, right? And dacrhea is when there is an excessive flow of tears. Um, Optia is a suffix that means vision. So you have up here the roots that mean vision, but down here you have the suffix that means vision. Doesn't that look like a nice parts question? Hyperopia, farsightedness, and myopia is nearsightedness. Doesn't that look like a both? Doesn't that look like a K question or opposite side of the coin question? Akinetopsia. It's not a common word, but we can break it down. Opsia, suffix that means vision. A means the prefix that means no or not. Kinetics, movement. So it is vision with no movement. So it means that you're gonna have problem with the movement of your eyes. Blepharo. All of these now word roots associated with the eye, but blepharo is your eyelids. So if I have blepharodema, that means I have edema, excessive fluid in my eyelids. Blepharoplasty, remember I talked about that more. It I wasn't the main physician on, but I was the one who got brought in. She's the one who got hit by that garbage truck, tore up her face. One of the things that it tore out were her eyelids. And they performed, the plastic surgeons performed plasty. That's a suffix, y, right? So that means it's a procedure. It's a surgery of plastic repair. So what did they do? They repaired her eyelids. Cornea or corrado. Now, your cornea is a hard covering of your eye. It's the outer covering of your eye, but it also means things that are hard because it's, of course, hard covering. So if you and keratitis And if you remember, well, why do I say if you remember? You'll have anatomy and physiology where we're talking about keratin, which is a protein on the upper layers of your skin that makes it hard. So think kerat, corneo, hard, al pertaining to the cornea, corneum, which is the hard part of your eye. The whites of your eye, that's your conjunctiva, inflammation or infection, conjunctivus. Sclera also means hard, and your sclera is another part of your eye that could also have an itis in it. But out of these, the eyelid is and corneo, these are more common. And conjunctivitis, you know that as pink eye. Lens, iris, again, I don't want to focus on this because this is not an anatomy class. Vitreous is a thick fluid versus aqueous. Aqueous is water. Vitreous is thick like jelly, thick oily jelly like fluid, and that's in the back part of your eye. And we could form a vitrectomy. We're removing what that fluid in the back part of your eye. Retina, cyclo. For our purposes, think cycle, but I don't want to get into what this is, right? Because again, I don't want to devolve into. I want to focus on medical terminology. So your retina is the sensory part of your eye. It's kind of like the cameras that pick up the light energy that translate into your the nerve, then it goes up to your brain. So you could have retinitis, inflammation or infection of your retina, which is the back part. It's like a back layer of nervous tissue. Retinoscope, also known as a slit lamp. Scope is the actual machine. Retinoscopy is the actual process of viewing the retina or the back part of your eye. Iris, Phaco, again, don't want to get into, but again, you look at the suffixes, they're common. Itis, inflammation, infection, algia, pain. So itis, inflammation, infection of your iris, iridalgia, pain in your iris. Same thing with Phaco. I don't want to get into anatomy. Aural, uh, aural or oral. And again, be careful because it sounds like oral, oral or per orum, po. That means by mouth, but this means by ear, pertaining to ear. And an otoscope is the scope, the actual machine that looks at your ears. Otoscopy is the process. Remember, scope versus scopy. Acoustic, ick, pertaining to hearing. Audiogram is the actual report, the actual recording of your ear test. And audiography is the ear test itself. Hyperacusis, osteoacusis. Acusis is hearing, so someone could be overtly sensitive hearing, and that's called hyperacusis. And osteoacusis, we not only hear through the air and through our ears, there's also bone conduction of sound, and we mentioned that in lecture. Cerumen, 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 is earwax. And if it gets out of hand, we have to perform cerumenolysis with a little mini vacuum and hydrogen peroxide. We want to break down that earwax. Salpingo, I don't want to talk about that, but tympano, Maringo, again, parts of your inner ear, but tympano is a little bit more common because tympano, like a timpani, which is a drum, well, your eardrum is your tympanic membrane, ick pertaining to your eardrum. Membrane, it's like a skin, and if you've ever seen a drum, it has skins on it, and that's what makes the noise. Tympanostomy, Stomy, I want to create a hole in your eardrum, and for a number of reasons. Okay. If I want to cut into it as well, it's called a myrigotomy. So these your eardrum, tympano, laryngo. Okay. Mastoid is a piece of bone that's sticking out in your skull on the sides near your ear hole. Your ear hole is called your auditory meatus. It's going to be spelled meatus. It's going to look like the word meatus, but remember, this is Latin and a little touch of Greek. It's pronounced meatus. So mastoiditis, inflammation or infection of your bone, your mastoid, and it could affect your hearing. Labyrinth, vestibule, cochlea. Your labyrinth and your vestibule have to do with your balance. So if you have labyrinthitis, vestibulitis, you're going to have a balance problem. And these are inner ear problems. Cochlea is it's like this conch or shell-shaped structure in your inner ear that has to do with hearing. So you'll have cochleitis, inflammation or infection of your cochlea. And if you have an inner ear infection, that means you're going to have a balance problem and you're going to have a hearing problem. So that's a both A and B problem. Let's jump to the eye. Conditions related to vision. Again, optia, right? Or opia. That's all vision. Those are all suffixes that mean vision. Now, you just attach roots and prefixes to it, and then you have all these different words. So, achinoptopsia, we already talked about that. That's no movement in my eye, right? Your eye should be able to move around, and in this situation, it does not. Diplopia, di means two. That means my patient's seeing double. Amblyopia, that means the left eye and the right eye don't have the same kind of. Ambi means both. So we're talking about what? Both eyes. Amblyopia, sorry. So amblyopia, both eyes. Amblyopia, opia, vision. Ambly is what? The two eyes aren't matching or aren't equal. Astigmatia, my patient can't feel, no feeling in their eye. Hemianopsia, they only have half vision. Hyperopia, remember, is farsightedness. Myopia, nearsightedness. Presbyopia, vision of old age. And scotopia, that means like they're seeing like spots or I think I failed to mention this in the lecture. The spots sometimes are like blind spots. So that's scotopia. So there's like sections of their vision that are either filled with those bubble-like things that I was telling you about. It's kind of like the way you look at the sun too long. Blepharo, remember, eyelids, tear glands, dacro. We have these. And again, a function of this video, I'm moving kind of fast, but you can pause it and then look at those and then match them up to your sample questions. Those ophthalmalgia, algia, pain, plegia, paralysis. We have some meds that will naturally paralyze your eye for obvious reasons. I'm doing surgery on it. I don't want your eye to move around. Astigmatism, that is when the shape of the eye is not circular. Your eye naturally is circular, but if you have an astigmatism, it's kind of closer to an egg than a golf ball. Corneal xerosis, remember, zero means dry, osis, abnormal condition of your cornea. Your cornea should be moist because of tears, and if it isn't, we have a problem. Keratoalgia, the hard surface of your eye is going to have some pain. Meiosis mydriasis. Remember, the pupil can get, which is the hole in your eye, the opening of your eye, can get big or small depending on how much light is in the room. Well, if you have a mydriatic drug, it's going to make your pupils dilate. So you look at the word mydriasis, it's longer than meiosis. So it's a bigger word. That means your pupils are going to get bigger. If I give you a miotic, it's going to constrict your pupils. Iridalgia, cyclopegia. Again, cyclo, I don't want to get into what a ciliary body is. A condition of the visual fields. That means you're going to have blind spots. You're going to have those, That's a scotoma. Oma is just means tumor, lump or bump. Scot is your visual fields. Hearing, we already went into this. Outer inner ear, outer ear, too much excessive flow of whatever um, uh, ear discharge, pain, more pain. Now, tinnitus, that's if you go to a concert or have some ear damage, and then it has that ringing, that constant ringing. And vertigo is dizziness. Ophthalmologist, optometrist, optician, scope, meter, myometer measures what? The muscles of my opto, eye. A phacouscope and retinoscope, it's the actual machine. Retinoscopy is the actual process. Tonometer is the actual machine that measures the tono or pressure of your eye for glaucoma screening. And glaucoma is a disease that your eye or your intraocular pressure is too high. And tonometry, remember the Y gives it away that it's the actual procedure. Binoculars have bi, two eyes, lacrimation. Nasolacrimal is the duct that deals with your tears, lacrimal, pertaining to my tears, and naso. And that's why when you cry, there's a connection between your tear ducts and your nose. That's when you cry, you start getting all sniffly, if that's a term. Those words, pretty obvious what those are. Again, going through the same thing here. And you could see it's like wash, rinse, and repeat. Exophthalmos, X is the prefix that means out of. This happens usually in hyperthyroidism. It is a us structure or structure of. X is out of. Opthal means eye. Nystagmus is when your eye like it's like twitches. Your eyeball. It's the best way to put it. Strabismus, nice to know, but what's better, esotropia and exotropia? Esotropia, that means your eyeball is moving. It's a problem with the muscles of your eye. That means the eyeballs, typically your eyeballs should move together. But if one or both of your eyeballs start going towards your nose, that's esotropia. That means the patient is cross-eyed. And if the eyeballs start straying outside, towards your sides or towards your lateral vision, that's called exotropia, also known as wall eye. Malacia, softening, right? The sclera and the carotid parts of your eye should be hard. If they start softening up, that's bad. Pterygium, you don't need to know what that is. You don't need to know what these choroid, retina. Again, I'd have to explain what your choroid is, and I don't want to do that. Now let's jump to ear. Otoscope, of course, is the actual device that visually inspects your ear. Skip salpingoscope. Again, I don't want to go into anatomy. Otoscopy, of course, the actual procedure. Audiometer versus audiogram. We already went over that. Audiometry, tympanometry. The people in your neighborhood, audiologist, that's the technician that's going to do the audiometry, which is your hearing test. Otolaryngologist, that's eye and larynx. Otorhinolaryngologist, which is eyes, nose, and larynx, which is your voice box, but we commonly call it ENT, ear, nose, and throat. And the otoneurologist deals with the nerves of your ears, which is both balance and hearing. Uh, Oral, we already went over. That's a good one. Ceranoma, ceraminosis, ceraminolysis. We know that ceramin, earwax. Outer ear size, macrotia, big ears, microtia, little ears. Autopyuria, again, pay attention to the discharge of their ears. If it's clear and smells, okay. If it's pus-like, a little bit yellow or even green, and it smells or doesn't smell, that's okay. Just beware. If it's clear, doesn't smell, that's a problem. Could be cerebral spinal fluid. Pyo means pus. Ria, excessive discharge. Auto, ears, of course. Autosclerosis, middle part of my ear starts being sclerotic. It starts being hard, and that's not a good thing because your tympanic membrane or your eardrum has to be a little bit, yeah, it has to be a little bit loose so we can hear things. And you know what happens, just real quick, you know what happens when you put your hand on a drum? It muffles it. Same thing with sound or hearing. Again, it's like repeating stuff. Right? We saw all of this. More repeating. Iris, right? And iridia. I have no iris. Iridemia. It goes. It's a emia is blood problem. Blood problem leading to iris. You know what? These are nice to know. The other ones that we stated before are better. Better medical terms. Again, I don't want to go through stuff about the lens and the ciliary body. Ooh, glaucoma. Glaucoma, I mentioned it. Oma means tumor, but it's not really a tumor. Glaucoma is a disease of your IOP or your intraocular pressure. If your intraocular pressure gets too much, it tends to